Hi, everyone. Welcome to ATP Live Monday. I hope you can hear me. I hope you can see me. If you can see me, if you can hear me, send me some messages. I hope you can hear me on Facebook, and I hope you can see me on Instagram. Okay, I'm trying to make sure everything is set. Okay. So if you can see me, if you can hear me, just let me know. Send me some messages, and I hope Heavenly Father, thank you so much. So Instagram people can see me. Facebook, let me know if you can see me yet. I can see a few people watching. All right. Okay, I think my moderator is also with me. So my moderator today is going to be joining me on Instagram, and then I will be alone solo on Facebook and YouTube. Welcome to ACP Live. It's been a while we did the ACP open house, and I'm sure Instagram people are excited that we're back. Hello.
Hello, Kima.
Okay, here.
I can hear you, ma.
All right, lovely. Welcome. All right, let me just check that let me just check our Facebook is pinned and all that. So welcome, share the video, invite your friends, family, and let's just have.
Yes. Good afternoon, everyone. Okay. If you are online, kindly signify. Good afternoon, everyone. How was your day?
Okay.
Okay, doctor.
All right, so we'll soon go start. I just want to make sure everybody is watching us live.
Okay, ma'am.
Just 1 minute to set up the people on Facebook to make sure they are watching.
Okay. Okay. Okay.
Yeah, okay, guys. I think I'll pin it to the top for them. All right.
Okay. Welcome to another episode of Ask the Paediatrician Live. We're going to be answering all your child health questions. If you're online, please kindly signify.
Yeah.
Okay. I can see some people online.
Okay, just saying hello to us.
Welcome. Yes, welcome. Thank you for joining us. Please send in your question. Doctor is here to take your question.
Please start sending in the question because we have very limited time. 1 hour. So yeah, really at the better. Yes, thank you. Because you say I'm online, thank you. All right, blessings. I can see you. I can hear you. Thank you. Thank you. Thank you to all those who are watching us live. So let the questions start to roll in so that we can quickly answer them. And then we have enough time. I don't like us to rush and like at the end, we are now rushing towards the end. So please let the questions start coming in.
Let the questions start coming in. Doctor is here to take your question. All child health related questions, please.
Okay, so while we're waiting for our questions to come in, so let me just remind you that this program is brought to you by Ask the Pediatricians Foundation. And Temitope, can you hear me? It's like we are overlapping each other.
Loud and clear.
Okay, so I'm just saying something, so just hold on a little bit. I hope there's not a bit of a delay because it seems like there's a little bit of a delay.
No, I can hear you loud and clear, ma.
All right, no problem. Okay, so I said before we're still waiting for questions to come in, I was just trying to tell people that this program is brought to you by Ask the Pediatricians Foundation. And Ask the Pediatricians Foundation, we are committed to the well-being, to the health of all children globally. And of course, starting with Nigeria, and then of course also we're now having a presence in Ghana and hopefully going all over the world. Of course, in our group we have
a new branch in Ghana now.
Yeah, in our group we have over 100 countries. Yes. So
Yes.
and thank God for, despite the COVID situation, we were not able to have our outreaches last year. But this year, by God's grace, this May, June, we are going to the schools to support them in knowing more about COVID, and also donating hygiene materials for them so that they can maintain the COVID protocol. So if you are happy to be part of that, feel free to reach out to us, and you can, even if you just check on our page, whether the Facebook group or our Facebook page or our Instagram page, you will see all the details. So we welcome you to be able to join us. All right. So thank you so much for joining us. I think I have some questions on Facebook, so I'll just take those questions on Facebook while we're waiting for Instagram. I'm not sure Instagram people have asked questions. All right. So Jennifer is asking.
People that have joined now.
Yes, so I'm going to take a question on Facebook while we're waiting for Instagram. So Jennifer is asking, my baby has some bumps on his head that looks like boils, but he has fallen quite a couple of times while trying to walk. Hope it is nothing to worry about. Okay, so Jennifer, if your baby has something on the head, we need to say it. Because you say it's a bump, it's a boil. They are two different things. So we really need to know. For example, if it's a boil, that is an infection, and that needs to be treated with antibiotics. But if it is a bump as a result of a fall, you will see the swelling should have happened almost immediately, and there won't be many bumps from falls. Won't be many, because usually just at one point or the other. So it's better you take your child to a doctor who can look and be able to advise you whether it's a bump or it's a boil or something else. So that would be helpful. So, but right now, without seeing it, I cannot advise you for that, because the treatment for boils or the treatment for boil or for bumps, they are two separate things, they are two different things. You really need to know that. All right. So for those on the group, if you're asking questions from the group, you need to, there's a place on the group notification that say you need to let Facebook give permission to Facebook to show your name. If not, you're only going to be showing as a Facebook user. But if you go to that, click, and then Facebook will allow your name to show. And most of you don't do that. So we always see you as Facebook user. Now, somebody is asking, Facebook user is saying, good evening, Ma. Please, is there any drugs that we can give to children to boost their smartness? Now, people have questions like this quite a lot. Just hold on. When I'm ready, I'll come back to you. Then I'll ask you to read, just so that we don't get it. People don't get confused. We will be switching between Facebook and Instagram. So, but when I'm ready, I'll come back. I'll let you know. All right. So, when it comes to smartness in children, it's not about drugs. So everything in children is not about drugs. In fact, the less drugs your children take, the better. So I know parents always think, what drugs can I give for this? What drugs can I give for that? And I'm always trying to tell them, we don't even want your children to be taking drugs. The less drugs, the better. Temi, talk about, there's a lot of noise background in your hand. Can you try and keep it to the minimum, and it's affecting my talk? Thank you. All right, thank you. It's better now. So we don't want you to be giving drugs to children. We want children, what children need for a child to be smart is genetic. Number one, he must have inherited some good genes from both parents. Two, nutrition. The child needs to eat good food, especially food that are very important for brain development. So your protein, your energy-giving food, and food like DHA, like essential fatty acid, we call DHA, they are very important for brain growth. So when your child is eating well, exclusive breastfeeding for the first 6 months, and then when you start complementary feeding, it's not just pap and milk. You are giving, protein, you are giving food rich in DHA, then your child's brain will be smart. And of course, there's also stimulation. The stimulation means you expose the child, you play with your child, you talk to your child, you take the child around to play, you expose the child to good interaction. Those are the things that children need for them to be smart. They don't have any drugs. So if you go to the shop and somebody is telling you if you take this particular drug, your child is going to be smart, they're only just ripping you off. And the less drugs your child takes, the better. Natural food, natural, stimulation from the environment. And if your child already has a genetic, those are the things that the children need to be very smart. I hope I've answered that question properly. And as much as possible, just avoid these mindsets of there's a drug for this, there's a drug for that. There is no drug for anything. Drugs are only given to children when they are sick. If your child is not sick, your child does not need any drug. So please avoid drugs. Even multivitamins, I'm not always encouraging it. It's better you give your child the fruits and the veggies. Let them get their vitamins straight from the organic source rather than from what somebody has extracted and they added other chemicals to keep it all together. The more natural they get these things from, the better for the children. All right, so let me go to the next question, still on Facebook. Oh my goodness, what are we going to do to your noise? Can you just put your microphone half or to the lowest? And when it's time to talk, then you can put it back on because it's creating a lot of noise. Thank you. All right, Kirsty is asking, how do I handle a 7-year-old who bedwets? Despite being taken to week constantly, she see bedwets before bedtime. If you don't wake her up in the next 1 hour, she spills on the bed. If you don't wake her up like twice in the night, she spills. How can I have it? So yes, so bedwetting, people always smack children for bedwetting because they think, oh, that means that child is not able to control themselves or the child is being naughty. But bedwetting is actually a medical issue. It's a medical issue. So don't spank children, don't abuse them, don't make them lose their self-esteem because they are bedwetting, because it may be a medical issue for them. So there are 3 things involved. We have what we call the brain, and you have the kidneys, and then you have the bladder. Now there are three things, there are different things that could go wrong. Number one, for a child to be able to control their bladder, you need to have you need to have certain level of maturation. So for example, we don't talk about bedwetting in children who are below 5 years because we expect at that age the ability to control their bladder is not yet fully developed. So, and this thing is ongoing. And so, but usually by after the age of 5 years, we expect most children would have developed that ability. But for some children, it may take longer. And some children, even we will say that 1% of children will still be bedwetting at the age of 10 years. And there's nothing wrong. It is just that maturation process. But there are things you can do as a parent that you can help your children to prevent bedwetting. I don't have enough time. I think I'm just going to come back and we can talk about bedwetting on its own as a topic because it's a big topic. But just going straight to the point, like for this kind of a child that, if I'm going to answer your own question specifically, this is your child, even though you wake the child up, the child will still wet. It means the child is producing a lot of urine. Your child is producing a lot of urine. And so that is why and the another thing that may be there is that the bladder capacity of that child may be small. So any little urine in the bladder, it will cause the child to wee, because you see the bladder is there are 2 things around that area. You have the bladder in the front that take care of urine, and you have the rectum where we store the stool. So I'm still going to come to that. Now, the reason why I'm talking about that is that one of the things you need to talk about in a child who is having bedwetting to make sure they are not constipated. Because when they are constipated, that means there's a lot of stool. If there are a lot of stool in the rectum, that stool will press on the bladder, which means that the space inside the bladder to hold the urine, the bladder won't be able to expand to keep the urine. And that means that the tap will always want to open and be leaked out. So for your child, number one, you need to make sure your child is not constipated. We can't even talk about bedwetting in a child who is constipated. So you need to make sure your child is taking lots of water. Many parents stop their children from taking lots of water because they think the child is bedwetting. You don't want the child to drink water. The opposite is actually the truth. You want the child to drink lots of water during the day. You want the child to take at least not to up to 6 to 8 glass cups of water throughout the day. So big cups 6 to 8 times during the day. But once it is night time, around 6, 7 p.m., you limit, that's when they should have the last fluid, 2, you don't give the child things like tea, things like coffee, things like chocolate. They have a lot of caffeine. They have a lot of these things are irritants to the bladder, so they make the child want to go and wee. And some of you parents, you always give them tea, plenty of it in the night. Wrong. So if you want them to take all those things, it shouldn't be in the daytime, but preferably let them drink water. No Coca-Cola, no coffee, no tea, nothing, because they are going to make them bedwet the more. So number 1, let them take a lot of water in the daytime. 6 to 8 cups of water, big cups of water in the daytime. So then let them eat a lot of fruits that have veggies and fruit, so that they won't be constipated. They can pass their stools softly at least once a day or at least every other day. So those are the things you need to do. And then, of course, you let the children learn to go and wee regularly at intervals. At least they should wee up to like 5 to 7 times in the daytime, so that they don't hold their urine when children are watching TV and they don't just want to get up. They don't want to get up. They will just stay down there. So you need to make sure that you let them wee. They don't wait until it is the last minute. So they should go and wee. And then before they go to bed at night, stop water by 6 to 7 p.m. and let them also empty the bladder at night. These are like what we call things that promote healthy bladder for children. Now, if you have done some of these things, most children will stop bedwetting just following some of those principles I've just told you. But a few children will still not stop. A few children will not stop because it is not because they're drinking a lot of water, but because the hormone, there's what we call the vasopressin. There's an hormone that concentrates your urine. And in some children, is only a little of it is produced. So for such children, they produce a lot of urine at night. And so we need to give them a replacement for that hormone to concentrate their urine so that they will not wee at night so frequently. So this is at this point where you need to now see a doctor, a pediatrician, and they can recommend that for you. And then you can watch. Some children also have some other bladder issues. We will look at those as well, and then we can treat. Some children also have urinary tract infection. We also need to treat that. So we need to look at other things that can cause that. But while you are waiting to do that, you can still follow some of these principles. If you go online, you look for what we call ERIC website, ERIC. It's a very big website devoted to anything about bedwetting or about constipation. They have lots of advice videos you can watch that will give you a lot of strategies and principles that you can apply. But one thing I think you should do is to encourage your child, and you can encourage them. You can also use what bedwetting alarms. It's also available. You also encourage a child, don't beat them. When they have good days, you praise them, so positive reinforcements also helpful. But these are just what I can tell you at this level. But if you have tried some of those things and you are still struggling, then you need a pediatrician to help you. All right, so let's go to Instagram. So if we don't accumulate questions on Instagram, I can see that Temitope is itching to read your questions. All right, let's go to Instagram. Facebook people can wait. Oh, I don't know what is causing this noise in your background. Maybe you should not use your headphone. Maybe you should just use your normal phone, your laptop, your phone itself, the speaker. I don't know whether it's make a difference. Yeah, maybe I think it's better. Yeah. Sometimes I find that headphone is very noisy. Yeah.
There are lots of bedwetting questions, but I need to jump them since you have addressed that.
Okay, so if you have questions about bedwetting, you can read them. Let's just read them. Let's make sure there's no aspect of it that I've not touched, and then I can just wrap it up once and for all.
About the 2 years and 10-month old child that has been potty trained and still bedwet.
2-year-old. 2-year-old, we don't talk bedwetting 2-year-old. Just leave that child alone. We start talking bedwetting from 5 years. So don't even bother yourself about a 2-year-old bedwetting. It's still, like I explained, their brain is not yet mature to that level. So let's move on.
Lola said, my baby of 10 weeks recently, I noticed that she hardly feeds. I was on a baby of 2 weeks, 10 weeks, on complementary feeding. That I have to change to EBF now. So I don't understand what she means by complementary for a child of 10 weeks.
So people use a lot of terminologies which they don't understand. So when you are with us on ATP, as a parent, I always say, forget the medical jargon. Don't use medical jargons. Just tell us, in simple English what you are doing. I'm feeding my baby with breast milk, or I'm feeding my baby with formula, or I'm feeding my baby with formula and breast milk. I will understand. Don't say complementary, supplementary. Don't use jargons, because you will end up confusing us, because we will assume it is what we are thinking, but you are actually meaning something else, because there's no way you can be doing complementary feeding in a 10 weeks old. So when we say complementary feeding, we're talking about children who are taking breast milk and solids. So you started pap, you started the cereals, those are the complementary feeding. So, but you said you are going back to EBF, so EBF is fine. You will never go wrong with me on that. So maybe you may want to react your question. Since you are live, you can react in a way that we will understand, that we can assist you. I can't even see the question on Instagram. I don't know what is wrong with my screen, but just keep reading them.
Okay, somebody's talking about a 19-year-old child here.
Okay, go on. Don't worry. We will take you. A 19-year-old technically is an adult. From 18, they are no longer my jurisdiction, but I will. Sometimes we have extended ourselves to even 25 sometimes. So feel free to ask your question. We take the youth sometimes.
Good evening, doctor. Thanks for having us. My 19-year-old son had an infection about 2 weeks ago. He got admitted and treated, but after a few days, his gums and lips are black. What could be the problem?
Gums and lips are black. Well, you need to, what drugs did they treat him with? So you may want to go, number one, see, when your child is ill and was treated in an hospital, anything you observe after that, you need to go back to that hospital, because they know a lot of things about that child. They've treated that child, so they definitely know lots more about that child. So always develop. Nigerians don't do it a lot, but ideally, whenever a child is discharged, there should be what we call follow-up. In other words, there's a time we should see you. Even if it's just to say, hello, everything is fine, there's no more problem, we are happy. You should always go back for follow-up. So it is not just to treat and that's the end. So in this case, when you not even have concerns, you definitely need to go back for a follow-up. So let the doctors who manage the child look. For me, just thinking generally speaking, I would think medication. For what medication was the child treated with that could have caused that? Some medication can give side effects, or it could be part of that illness itself. It could be, I don't know what illness, you just said infection, very unspecific, but it could be part of that illness the child was treated for. So, but the best person to know that will quickly figure it out are the doctors who treated your child. So I will advise you, take the child back to them for your follow-up. Just bring them, say you want to bring the child back because you still have some concerns.
Okay. Somebody said, please, Ma, can you give us examples of food rich in DHA?
Yes, I can. So, for example, egg has DHA. Seafood like your and fishes, like your sardine fish. There are different kind of fishes, but generally most of those fish oil, they tend to have DHA as well. So, and of course, there are also some milk that people are fortified with DHA. You can also get it from there, but generally seafood products and eggs and all that, they always have DHA, and you can get lots of DHA when you include. That's why when we say when you start your children on pap, you don't just give them pap only. You need to give them other things. So adding crayfish or adding those fish, boil it and add it to the food you're giving your child is a way of making sure your child is getting the DHA, which is very important for their brain, because the brain is not fully developed at birth. The brain is about maybe 75%, and most of the 95% of brain development occur in that first 5 years of life. And so nutrition is very important in the first 5 years of life, because the brain is growing. And if you are not giving the brain the right nutrients and the right things for it to grow properly, then you can end up causing significant it can impact the brain significantly, which can have a long-term consequences for the child as well. Yeah. Even breast milk has DHA. That's why we always say exclusive breastfeeding in the first 6 months of life. Yeah. And you keep breastfeeding even when you are doing the complementary feeding as well.
Can we take more?
Yes, please.
On Instagram?
Yes, just take all Instagram, then I'll go to Facebook.
Okay. Please, my 8-month baby has tiny pimples like rashes in a public region. We saw a pediatrician today. He said it's diaper rash and prescribed prednisolone tablet, Whitefield, Floconate, and even wanted to give. The question is not complete. That he wanted to give.
So what's the question? Are you reporting the pediatrician to me? Because I don't know. Because you've already seen a doctor. So what is your concern? So it's better to go straight to your concern. And as much as possible, I don't like commenting on what's... Sorry, I didn't hear you.
He said the doctor wanted to give injection. That is a steroid injection. But I refused the injection. Please, I've been worried. Aren't all this too much for ordinary diaper rash?
So that is why you need to have this conversation with that doctor, because I seriously, mothers, I think you guys need to be more proactive, because most of you in the hospital, you don't ask this question, but you come and ask me when you come back. So please ask the doctor. So there's nothing wrong with you saying, doctor, you say my baby has diaper rash. So why do you want to give injection? Why are you giving steroids? I mean, why are you giving this? And then the doctor, you have a right to know, and the doctor has a right to explain, like, oh, this is why, because like you rightly said, I am also confused myself, like, okay, you just told us that this baby has diaper rash. And so where does steroids and all those other things, where do they come in a child with the diaper rash? So it's either the diagnosis is wrong, or you didn't understand the jargon the doctor is saying, or I don't know. But because number one, I'm not seeing your child myself, so I can't comment about whether what it is the diaper rash or not. But I know that diaper rash does not need steroid treatment. I know diaper rash does not need injection. I can answer that. But I don't know whether there are other things your doctor has seen that this pediatrician saw and decide to treat your child with all these other things. I can't answer that because I have not seen this child myself. So I always say, ask your doctor the questions, so you can ask them, what is it that you're treating my child for? Anytime you go for a consultation, you have a right to know what is the diagnosis, what is wrong with my child, what if you are giving me any particular drug, what is that drug supposed to do? Sometimes we give drugs that are not necessarily related to the diagnosis itself. For example, let me give you a very simple example, because a lot of people ask that question. You have gone to the doctor because your child has diarrhea, but then the doctor give you ORS, and some of you think that maybe the ORS is supposed to stop the diarrhea. No, the ORS is not going to stop the diarrhea, because a lot of you will now come back. I've been giving the ORS, so I've been giving the oral zinc, but the diarrhea has not stopped. We were not giving you the ORS to stop the diarrhea. We are not giving you the oral zinc to stop the diarrhea. That is misunderstanding. We are giving you the ORS because we want to replace what the child is losing. We are replacing the fluid. We are not trying to stop the diarrhea. So, but parents always have the impression that when my child has diarrhea, and the doctor give me a medication, the medication means when I give it like this, the diarrhea should stop. But that is not. So that is why I always try to say, understand why the doctor is doing what they're doing. So why is this doctor giving you prednisolone? For example, your child may have, so for example, let me come to your diaper rash. There are two, when you say diaper rash, it's just a non-specific term. In other words, there are rashes in the diaper area. Now, rashes in the diaper area can be two types. A rash can be due to irritation of the stool or the urine in the diaper area. So if you are not changing your diaper frequently, you are not using diaper cream, your baby can have irritation from those products. And that is a form of a diaper rash. Now, a baby can also have infection, fungal infection, bacterial infection in the diaper area. So that is not the irritation kind of diaper rash. You can still call it a diaper rash because it's occurring in the diaper area, but it's not due to diaper irritation. It is due to an infection. So if I see that kind of a child, for example, the child will need antibiotics. The child may need antifungal. Maybe that's why your doctor is giving you antifungal and all that, because what you have in the diaper area is an infection. Now, my child has a fungal infection in the diaper area, but it's different from my child has diaper rash, which you don't even need to see a doctor for, because all you need to do is to use the diaper cream. like you make sure that you change diaper frequently, make sure you use the diaper cream like pseudo cream and all those things, and that's it, and your child will be fine. Some children will also have rashes in the diaper area as a result of reaction, allergic reaction to the diaper. For example, some of you that use rubber nappies that have the rubber part of them, some children are allergic to rubber and they will have rashes from that. And those are the kind of children that maybe your doctor wants to give you steroid for because it's a allergic reaction. So you really need to, so I'm not saying your doctor is wrong. Remember, from everything I've said, I've not said doctor is wrong, but you need to know what exactly the doctor is thinking about. And you have a right to ask. Don't be scared. Ask, and a very good doctor, a very good pediatrician will just explain it to you like I'm doing right now. And so I think there's an infection. That's why I'm giving you this white feed ointment for the fungal infection. Or I think there's an allergic response here, and that's why I'm giving you the steroids. So that is it. So you have a right to ask. And if you're not convinced, you have a right for a second opinion. You just go and see another pediatrician and get a second opinion. So that is what I would say about that. I think we can leave it at that now. All right.
All right, somebody said my 4-month-old baby has not increased in weight for 2 weeks. She did not even state the baby's birth weight or current weight.
We can't answer now.
Baby increase in weight for 2 weeks.
When you ask a question about weight, you need to give us figures. We need that figures to be specific. For example, your baby may even be overweight already, and we want baby to remain on that weight or even lose weight. So we need the figures, fat and figures, more important. And your baby don't have to gain weight. As baby get older, the rate of weight gain slows down. So in other words, the rate of weight gain will slow down. So for example, children will go from 3 kilos to 10 kilos in 1 year. But from 1 year to 2 years, they're only going to gain 2 kilos. So in the first year of life, they're gaining about 7 kilos. But in the next second year of life, they're only going to gain 2 kilos for that same 1 year. So parents always think they should just be adding the weights like the way they were. No, it's not going to be the same. So rates of it tends to also slow down. So you need to let us know the exact figures, then we can compare to what is normal. And then it's a range. Some babies will be a little bit bigger, a little bit lower, but it still may be within normal. So it is when it is really off the charts, too low or too high, that we will not tell you, okay, we need to do something about it. Yeah, and also check your scales, because scales can also be misleading. So some scales can also, so you have to use the same scales every time so that you don't get confused. Yeah, so that's that. Okay. Should we go to Facebook before we continue? Let me give you a break. Yeah. Let's quickly go to. You said?
No, the same question you just attended to, the diaper rash question. Okay. You said the doctor said it's a fungal diaper rash.
Yeah. So your doctor has explained to you. So you can only just ask him, why is he doing the steroid? So you don't understand why he's giving you the fungal infection, the fungal cream or whatever. But the steroid, you can ask the doctor why. There are times when we use steroid as well in some infection, if there is some excessive inflammation, but you need to ask your doctor those questions. Don't just assume, because sometimes parents also assume they know more than the doctors. It's okay, but please just ask us to defend ourselves and tell you why. Every decision we take, there's a reason behind it, even when they don't tell you. So if you ask, then the doctor will explain to you. And if you're not comfortable, it's also a voluntary thing. Sometimes you're not comfortable, you say, I don't want it. There are people that have cancer, they will tell them they're going to give them chemotherapy, and they'll say, I don't want it. So you say, it's just that for children, it's a little bit dicey, because it's between the parents and the pediatrician, what is the best. So we always look at what is the best for the child. You know, but if it's like you're an adult, it's okay. It's okay for you to say, I don't even want the doctor's treatment, and we have to respect your decision. So don't feel compelled that you must always follow everything you are told, but then you must know the consequences for your decision as well. And when it comes to children, in some countries, the government can step in and say, what is the best for the child is what we're going to do, even if you don't like it or not. So I hope that is helpful. All right, let me just quickly go to Facebook, people. So Adaku is saying, is Vaseline good for a newborn or a toddler? I hope you are not trying to advertise on Vaseline. Okay, Vaseline is good for everybody, so you can use it even for newborns. Yes. Edith is asking, my baby of 7 months has recurring rashes on her face and her neck down to the shoulder. The first time doctor recommend this cream is clear, now it's back again. What will I do? So if your doctor treated your child and your child has the same thing back again, go back to the doctors. I don't know. There's no law that says some things cannot happen again. It can happen again. It does not mean the doctor was wrong the first time. It does not mean, the question is, why is it happening again? And so that's what, so for example, what if you, from what you said, maybe your doctor was treating infection. Infection can happen again if you get exposed to the same germs. So if it is happening recurrently, then I'm going to be asking you, how are you treating your child? Who is carrying the child? Who is touching the child? Are they washing their hands? I mean, are they taking care of basic hygiene? If you don't do all those things, then your child will keep on having infection. So some of you take your children to daycare and they just touch one child and then go to another child without washing their hands, without using soap and water. It's going to happen again. So it is not like also treat you and something happen again. You're like, why should this thing happen again? It can happen again if what causes it in the first instance is still present. So for Edith, just take your child back to the doctor and let the doctor treat the child again, and then let's discuss why did it happen again and what can we do to prevent it from happening again. Thank you. Another Facebook user, obviously from our Facebook group, saying my 9 months, 2 weeks old is yet to start crawling. Is 8 kilos. Should I be worried? You don't have to be worried. Number one, 9 months is actually the average age when most babies crawl. But some babies never crawl. Some babies don't crawl at all. But they can do what we call bottom shuffling. They move with their bum. They sit down and just keep moving. So some babies are like that. And even for a 9-month-old, so when we say a baby a baby is supposed to do something at a particular age, always know that what we are saying is that is the average age when 50% of children will do that. It doesn't mean that some children will not do it earlier. So some babies will crawl at 6 months, some babies will crawl at 7 months, and some babies may not crawl until 1 year, and it's still perfectly normal. So it's always a range. So don't panic when your child is not doing it. So, but we have what we call a limiting age. So that limiting age is when you have to come and see the pediatrician. So, for example, the limiting age for crawling or bottom shuffling, we'll say it's 1 year. So if your baby is not bottom shuffling and it's not crawling by 1 year, then I will want to see the child, make sure there's nothing going on that we're not, that we're missing. But you don't need to panic. I know parents do a lot of comparison. It can be nice, but sometimes it can be unnecessarily competitive. So you don't have to worry about your child. Just watch. As long as the child is doing other things, like you told me, your child is sitting with support, your child is already dragging himself on his tummy. So it looks like a child that is just going to crawl very soon. So I will not even worry about that child. That's all. All right. Okay, another person, when should I stop using antiseptic? I guess you mean antiseptic in the bath water. If you're talking about antiseptic in bath water, it depends on your water source. So some of your water source, you are not sure. Maybe you are using well water, rainwater. You are not sure of the hygienic level of that water. It's safer. It's more, it's been on the safe side to just put a little bit of mild antiseptic liquid in your water, like the popular one you normally use. So you can use that. But if you're sure you're getting water, maybe from government tap water that has been properly treated, because government treats their water with chlorine. So if they chlorinated the water, that is a form of antiseptic. So if you are using this kind of water, there's really no need to add antiseptic. But if you are not sure, you are not losing anything adding a little bit of antiseptic to your bath water. For all children, even the older ones, doesn't matter. So, but it's not compulsory, but just be sure. Okay, another person saying, I've been trying to potty train my 1 year, 7-month-old. It's been frustrating. Yes, it's frustrating when you are trying to teach something new. So just be patient, just be calm. And every child is not ready at 18 months. That's the truth. Some children are not ready at 19 months. Some children are not ready until 2 years. When they are ready, you will see the sign that they're ready. But try and make it fun. Buy nice potty. Let the potty be something you can place even in your sitting room. Let the child be able to sit on it even when they are not pooing. Let them enjoy it. Show them books or cartoons where they see other children sitting on the potty. When they see that, then they like that one is sitting on the potty. I'm also going to sit on the potty too. They will enjoy it. They will love it. There are songs about it. Those are the ways which you can make children do those things without them freaking out about it. But if you make them just, oh yeah, sit on your bottom now, yeah, 5 minutes, they are not going to do it that way. So you have to be patient. Sometimes we always tell parents, you may want to take out like 2-3 weeks, or maybe when you're on leave. There's no point doing it when you are not also available. It's better during the school holiday. It's better during the summer period, so that children will not be cold. You can take them off their diapers and all that, and then you're also available. Maybe you take leave, and then you are ready to do it, because you have to do it consistently. And first thing in the morning, you make them sit on the potty. They don't have to do anything on the potty. Just get them used to that sitting on the potty and all that. So some parents always feel frustrated because the children will sit on the potty, they will do nothing. Then immediately they get off the potty, then they will do the wee or they will do the poo. It's okay. You're going to have lots of accidents. So get ready, get your what do you call it? Macintosh, all those things, get them ready to handle everything. So these are things that you really need to do. I hope that is helpful. All right. Somebody say I can't hear you anymore. Oh my goodness. Can somebody else hear me on Facebook, on Instagram? Let me know, because somebody said they can't hear me. So if you can hear me on Facebook, just say yes, I can hear you, because I want to be sure I'm not lost on Facebook. Or maybe it's just Costy. If it's just Costy Finney, I think you should refresh your page, and then we can take it up. Okay, just let me know. Oh, people say they can hear me. Oh, thank you, Shiwendu, and then the rest. Okay, they can hear me. So maybe it's just Costy that needs to refresh his Facebook page. Okay, Amalachuku is saying, my baby of 3 months are boys. They always go and come back. She takes antibiotic, they will go. Then after 1 week, they will come back. Exactly. So if you're having recurrent boils, so there are many possible reasons why your baby could have recurrent boils, especially in a 3-month-old. If a 3-month-old is having boils, it is from the hands of the people that are carrying the baby. It's from your hands. so you must wash your hands. And in African culture, everybody just carry baby. Baby, bam, bam, squeam, bam, bam. It's not good. People do it a lot. I know it's our culture, but it's actually wrong. So please stop letting people touch your baby, kiss your baby without washing their hands. In fact, don't let them kiss the baby at all, because they have their germs. It doesn't disturb them. But for a baby, you keep on putting it back on the baby. So you need to improve on that. Then some people could also have what we call low immunity. Some babies have low immunity. For your baby, I hope you're exclusively breastfeeding. It is one of the reasons we have to exclusive breastfeed, because you protect your babies against all these kind of infections. Exclusive breastfeeding, hand washing with soap and water. Thank God for COVID. It has taught us how to maintain hand hygiene all the time. My hand sanitizer is always next to me. So you always make sure that you use your hand sanitizer, or people, make sure people do that before they touch the baby. And for everything, you change diaper, you wash your hand. Before you do it, after you do, you wash your hands. So these are some of the things you should be doing. And also, even the clothes, even the bathing, everything, you need to make sure that you maintain good hygiene. So if you are doing good hygiene, exclusive breastfeeding, baby is immunized, and your baby keep having recurrent infection, boils, and all that, then we need to investigate, does this child has immune system issue? So there are blood tests pediatricians can do and all that. But for me, most of the time, the babies that have those low immunity is a very rare condition. It's a very, very rare condition. So most of the time, it has to do with our hands. So that's that one. I hope. But see your pediatrician, let them treat the current infection. But more importantly, let them investigate and advise you further. Okay, my baby has 16-month-old has only 2 sets of teeth. Downward, should I be worried? You don't have to be worried, but if you are, you can see the dentist. They will advise you further. But some babies take their time bringing out their teeth, and eventually they will all bring out the teeth. So it's a range. I think at least before 2 years, you should have all the teeth out. So, but if you are worried, the dentists are always happy to see you. A baby of 7 years. The baby of 7 years, should be 7-year-old baby. Anyway, a child of 7 years. Notice that his panties always wet when he wakes up. I'm not so sure what you are trying to say. You need to really ask your question clearly. So, is your child bedwetting or not? Or are you worried whether your child is having like wet dreams or something like that? If that's what you have in mind. So you really need to ask that question again so I know which one you're asking, because I don't want to answer the question of bedwetting for the child who is having maybe wet dreams or something, which is very, very young for a 7-year-old, but there's no never. Okay, let's go back to Facebook. All right. I mean Instagram. Yeah, Timmy, go ahead.
Thanks for all you do, ma. Can I add a little sugar to my baby of 6-month-old pap?
You can, yeah. You can.
Okay.
You can also use the formula. You can also use dates. There are many ways you can sweeten the pap, but there's no law that says the pap has to be plain on tasteless pap that the baby could eat. No, there are many ways you can fortify the pap, but it is not just the pap. It's not just the sugar. There's milk. There should be maybe protein like egg or crayfish and all that. It should be a little bit of palm oil when you cook it on fire, so that you are making the pap a balanced, kind of a meal with so many other things. Whenever you are giving your child a meal, there must be at least 4 or 5 of the food classes. So we have what we call the carbohydrates or the energy giving food. That's the pap, the corn or whatever, whichever one you're using, the cereal. Then you must have something that is a protein, which is the bodybuilding food. So you must add either crayfish or your egg or your fish. You can blend them into powder. There are many ways you can do that. And then you must have something like fat. Fat doesn't have to be much, but it has a lot of calories. So just 1 tablespoon of palm oil into that pap when you're cooking it on fire. Splendid. And of course, a little bit of sugar for taste, or you can use the formula or you can use some use dates or anything. Just make sure it has it. Any food you give to your child, taste it. Some of you give your children food that they themselves, you yourself, you can't taste, and then you now say they don't eat. Why would they eat food that is tasteless? So you can do that. And the pap should be porridge. It shouldn't be liquid that you'll be using feeding bottle. You should feed them with cup and spoon, and it should be thick. When you take something that is a thick porridge, when you turn it upside down on the spoon, it won't drop. That is thick. If it is liquid, it will flow. So those are the things that you can do. So make sure that your baby is not just taking pap and milk, because that is not appropriate complementary feeding. All right, let's move on.
Good evening, doctor. My baby of 7 months old has no teeth yet.
There's no need to worry.
His weight is 3 points.
Yeah.
Current weight is 11 kg. His overall healthy. I'm just concerned maybe there's something I need to give him.
There's nothing to give him. Just leave him alone. It will bring out his teeth when he's ready. Usually some babies don't have their teeth until their first birthday, and it is okay. It's perfectly normal. Okay. Any more questions? Should I go to Facebook?
No, hold on, ma. While I check if there are more questions.
So I can see somebody giving us more questions. I think the lady that asks about the steroids, asking us if I no temperature, no itching or anything. I talk about the injection, and she's telling me it's a steroid injection. To be honest, I don't know why your doctor wants to give your baby any injection. I am not a fan of injection. So in children, unless it's really, really bad and there's no alternative. So it's okay to ask the question, but I don't really know. I don't want to comment about other people's treatment, but I really don't understand why the injection steroids. Oh, really? Okay, let me go back to Facebook. So Lavina is saying, can allergy cause fever? Allergy cause fever? Really, no. Allergy, I guess it means an allergic reaction. So if you are reacting to something, most time it can come as rashes, it can come as itching, maybe redness in the eyes, maybe stuffy nose, depending on where the allergic reaction is manifesting. But fever is not really a typical response. So if your child is having fever, don't assume allergy, go see a doctor. Okay, first of all, Roslyn is saying, how can we treat impetigo in a 6 months and whatever weeks? He has been coughing, having catarrh for the past 1 week. What can we do? What you can always do when you have a sick child is always take the child to the hospital. I don't know why I get that question all the time. People ask, what can we always do? I guess you always ask, like, what is the home remedy? Some things don't have home remedy. If a child has impetigo, that's impetigo, for those who don't know, is like a bacterial skin infection, and your child is also having cough, is having catarrh for 1 week, and is having rashes that is bacterial kind of. I hope you are correct, because sometimes I don't take parents' word for anything. Especially when you use medical jargon, so I prefer you explain to me or I say it. So just take the child to the hospital. Take child to the hospital. Doctors are meant to treat children. I mean, doctors are meant to treat sick people. I know mothers will wear a lot of hats, but please, your hats also, you need to know when to let the professional do their job. And so when your child has been sick for 1 week, that is not the time for you to still be saying, what can I do? That's the time for you to take that child to the hospital for a doctor to see the child and to treat the child properly. So that's impetigo is something that requires antibiotics, and a doctor has to prescribe an antibiotics. Please, let's stop using antibiotics when a doctor has not prescribed it. It's called antibiotic abuse. And the challenge with that is that when your child need antibiotics, it may not work for them because they would have developed resistance. So please, mothers that are fond of just walking into pharmacy, buying antibiotics, using it anyhow, you are causing harm to your children for the future. And that is the truth. And the truth of the matter is that medical science is not producing more antibiotics. So we have limits to the number of antibiotics we can use. So if your child is not responding to what we have, it can be a filter thing. That's the honest truth. So please avoid indiscriminate use of antibiotics. Please only use antibiotics when a doctor has prescribed it for you, because it has to be the right antibiotic, it has to be at the right dose, it has to be for the right duration and for the right condition. So most parents don't know that. So if you just go and buy anyone that they love, it can be very dangerous. So please, let's not do that. All right, Otunye Blessing saying, what is the right time to start potty training? The simple answer to that question is when the child is ready. You start potty training a child when the child is ready. How do you know a child is ready for potty training? The child start giving you signs when they want to poo. They start giving you signs, like they will come to you, or they will try to take off their diapers and all that. Then you know that child is ready. Or when the child has pooed, the child will come to you and give you sign that they need to they need to be changed. So if your child is already doing that, and the child at least has some ability to take off their pants down, pull it down, then they are ready. Of course, the child must be sitting, the child must be walking. It doesn't have to be talking, but at least must be able to give you those signs. So a child who is not yet giving you signs is not yet ready. That is the honest truth. So please, most children are ready by 18 months. So some children are not ready until 2 years max, but at least most of them are ready for potty training, usually from 18 months to 2 years. So by 3 years, we expect them most of them to be fully potty trained already. So but watch out for the signs. And we have an article on how to do it as well. And I think we're having a group discussion on potty training. Or is it Wednesday? When is it? I think it's during the week. It's on Wednesday. Okay. So Olanike is asking, does dry skin cause rashes? That question is a little bit kind of tricky. Okay, so dry skin on its own just means your skin is dry. It is not rashes. But if your skin is dry, you tend to, itch it or, scratch, and that may end up causing rashes. So the best thing is to avoid having the dry skin. Some people have dry skin naturally. So what you need to do is just use moisturizing cream. So moisturizing cream is not only applied, if you have dry skin, it's not only applied when you have your bath in the morning, which is what most Nigerians do, but you can apply your cream throughout the day. So you can do that. You don't have to have another bath before you apply cream. Once you notice your skin is getting dry, you can apply it, and preferably use for children. If you're asking for children, use hypoallergenic cream. All right. So somebody is saying, Rosemary, I would like to know a response to, I don't know what is the response to Rosemary. What was the question that Rosemary asked? I'm just trying to look back and say, because I'm not so sure what question Rosemary asked. Okay, so let's just move on. Whoever is asking about Rosemary, please ask your question by yourself because I'm not so sure who you are referring to. Okay, so Olanika say, what's the right month for a baby to start sitting? Most babies start sitting with support from 5 to 7 months, and by 7 to 8 months, they start sitting without support. So, for Olanika, if you want to know more about developmental milestones, go to www.askthepediatricians.com. We have a website article on your child developmental milestones on course. The same thing for Jennifer. Most babies start crawling around 9 months. So if you want to know more, the same answer I gave to Olanike, go and read the website article on is your child development on course. That's that. The fact that a mom work at 1 year, does it mean baby will also work at 1 year? No, doesn't mean baby will work at 1 year. So your developmental milestones doesn't necessarily affect your baby. If your baby has other issues which you didn't have, it may affect your baby's own developmental milestone, but it's not necessarily that it's not automatic. It's not automatic. Let's just leave it that way. I don't know why this person is saying who will go Ellen. I don't know. Okay, all right. So do we still have questions on Facebook? Let's go back to Instagram. Okay, and then I can come back to Facebook. Okay.
Okay. Good evening, ma'am. My 20 years old baby keep adding
20 years old.
To every 20 months old. Sorry,
oh, I was worried.
20-year-old baby, that's 20 months old, keep adding to every word he's saying. Like saying sorry, he will be saying sorry. When he wants to say yes, he say yes. Should I be worried about that?
Yeah, that is what we call echolalia. So your child is echoing you. In some children learn language at some point by being doing echolalia. In other words, they repeat words after other people, and that's how they learn language. But usually by age of 2, we want you to stop. And if they are still echoing beyond the age of 2 years, your baby is still 20 months, maybe you should still give it some time. But by the time your baby is 2 years, if your child is still echoing, because by 2, you expect the child down to have his own words. So instead of repeating after you, the child should say, if you say hello, how are you? The child should say fine. Or what is your name? The child should say his name. You should not be like, the child will say hello, and I've been trying to say how are you, and the child also say how are you. You want the child to respond. So if by the age of 2 your child is still echoing, then please see a speech therapist or a developmental pediatrician. But at this point, if that's the only thing, I will not worry. But if there are other things, for example, other things like maybe it's not responding to the name or there are other concerns developmental wise, then it's better to see the pediatrician. Okay. All right. Let's move on.
What's the limiting age for a child to walk well?
18 months. 18 months. So a child should be walking at 18 months. If your child is not walking, not necessarily, I don't know what you mean by walk well, but at least the child should be walking. If the child is not walking by 18 months, you should see a pediatrician. If the child is walking, maybe not yet balanced, or the child that just started walking, give them some time to to maintain their balance. I think, but we will worry if a child is not walking at all at 18 months. Yeah.
Please, ma, what causes dry skin eczema?
Sorry, come again.
Please, ma, what causes dry skin eczema?
Okay, so dry skin and eczema, they are not the same thing. No. So dry skin, some people just have dry skin, but if you really mean eczema, because people who have eczema also have dry skin, but it's part of a bigger condition which we call atopic dermatitis or atopic eczema, which is basically an allergic skin condition. It's a genetic condition. Nothing causes it. It's something the child is born with. Just like the same way some people have asthma. It's just the same way people have some people have allergic skin. Some people just have this sensitive skin. I like to use the word sensitive skin to explain to parents. So some children have sensitive skin, and so whenever they are exposed to anything, what we call triggers or allergens, then they break out with rashes and all that. So So, and then they will start having that dry skin. Not only dry skin, there'll be weepiness, like as if they may be changing color, like as if it's making water, those kind of, you see a lot of things going on in the skin. And so it's a allergic skin condition. So people that have those kind of skin condition is just part of who they are. That's how they are born. So the best thing is for them to avoid anything that will trigger, and then they tend to itch their skin a lot, itching and all that, which worsen it, and then they may not have secondary infections, which can be bacteria, fungi, any one of them. So the most important thing is, number one, avoid chemicals, things that could trigger reactions. So those are the people that we always recommend that you should use hypoallergenic products. So products that have little or no chemical and just natural. Like your Vaseline without perfume, or your shea butter, or olive oil, things that don't have perfumes, because those are things you have. Then also, we always encourage you to keep your nails short. We encourage you to keep your nails short, to moisturize the skin frequently and all that. And of course, sometimes you have to be seeing your dermatologist, because if you have a flare, when they have those breakouts of the allergic condition, then they may need additional treatments, maybe drugs to stop the itching, maybe steroids, like the other person who was asking. We use steroid more in eczema, but then we try to use oral or topical steroids, not injection steroids, as much as possible. So those are the ways by which it can be treated. Okay, so it is not dry skin like that. It is a condition, it's a medical condition on its own. It's different from those who just have tendency to have dry skin, just like some people also have tendency to have oily skin. So that one is different from atopic or allergic eczema or dermatitis. Okay.
There's another question.
Your place is so dark. We can barely see your face, Temi. Are you not? Is it possible to introduce some lights into your location? I'm struggling to see your face.
Okay.
At least I can see your teeth shining through. All right, go on. Anyway, but if you can open your windows or let there be some lights, it will be better.
Never just did their usual now.
Oh, okay. Sorry. All right, just go on. Don't worry. I'm just one worrying. I'm not seeing your face.
A baby of 7 months sometimes cry out from sleep. Is this normal, please?
It can be normal, yeah. So sometimes children dream as well, and they relieve what they've done through the day. And so if the child has cried and screamed during the day, the child can also cry and scream at night, because it's their dream. It's what they've done during the day. So it does not mean an evil spirit is attacking the child or something. So like most parents do. So just reassure the child, pet them, and let them go back to sleep. So it's fine, yeah.
Lade said, what part of the egg can be added to the pap of a 6-month-old baby? The yolk or the albumin, or just
everything can be added. Everything can be added. Everything. The whole egg can be added. Yeah. You don't need to separate them. Unless your child is allergic. And that is why when we say when you are introducing something for the first time, you add it one thing and check, but if your child is not allergic, you can add everything. At 6 months, you can add everything.
Okay. So Ewatomi said, good evening, ma. My baby of 2 years and a month old is not talking much. He only says dada and numbers, but not clearly. So should I be worried?
How old is the baby?
2 years and a month.
I will be worried if a 2-year-old does not have more than, because at 2 years we want them to start combining words together. So the rule of the thumb is 1-year-old 1 word, 2-year-olds 2 words together, 3-year-olds 3-word sentences. So if your 2-year-old is only saying dada and it's not even clear, I would recommend you see a speech therapist for proper evaluation, and or developmental pediatrician as well. Yeah. It may just be a little bit late, but in the interim, you can also stimulate your child's language. So if you go to our Facebook group, we have a guide section on what I call DIY, do it yourself speech therapy for parents, how to help your child to how to stimulate your child's language development. You can start trying some of those principles, but you should also see a speech therapist as well, just to be on the safe side. Yeah.
Okay. Ebere Collins said, Ma, please, my baby is 1 year, 7 months and weighs 10 kg. Birth weight is 2.6. She feeds well, but should I be worried?
1 year, 7 months.
Yes, weight 10 kg.
Not so bad. We expect it to be at least 11 kilos, but 10 kilos is still within normal. Okay, our time is really gone. I just checked the time now so that it's already 7 o'clock. Oh my goodness. Okay. How many more questions on Instagram so I can rush through Facebook and then?
No,
that's the last one. Oh, lovely. There are some questions in the question box. Did you check it? Okay, yes. I think you've answered. Yeah, you read them. Okay, lovely.
Yes.
Okay. Okay, let me go back to Facebook, then we hand it there. Thank you so much. Our time is gone. So if you have dropped your question already, I will answer them. But please don't drop more questions because we will not be able to take them. Okay, so maybe she's not bedwetting. I'm not so sure what this Facebook user meant. So if you are responding to my answer, you need to give me a complete scenario so that it makes sense to me. What are the side effects of continuous intake of vitamin C in a child? So there's no reason why you should be giving your child vitamin C continuously. Yeah, I think I have a group, a post about there's a dose of vitamin C that could actually be dangerous. The good thing is that most of the vitamin C is a water-soluble vitamin, so the body excretes most of them in the urine. But if you take too much of it, then you are going to overwork your kidneys, because the body is only going to take what it needs, and it's just going, half of what you're taking is going out in the urine. So there's no point taking too much. You're just wasting your vitamin, and then you're overworking your kidney, doing all the excretion and all that, and then you can lead to kidney stones and all that. So just give your children fruits, vegetables. Don't need to load them with all this vitamin C. And if you want to give them vitamin C because you're not taking fruits and vegetables, then make sure you are giving them the right dose. I think we have it depending on the age of the child. If a people does not triple his birth weight, is it bad? No, there's nothing bad. So we give you those guide as a guide. It's a guide. It's just to give you an idea. So like I've already told you, like the question I answer now about the person who say my baby is 1 year, 7 months, ideally baby should be weighing around 11 kilos, but baby is weighing 10 kilos. It's still there's still a normal range. So as long as the baby is on the center, 25th to 30th centile is still fine. As long as the baby is not below the 5th centile or the baby is not above the 95th centile, it is fine. So we have a range. Everything is not absolute figures. There's always a range. Okay, Ismail Ali is saying, what can we do to recurring lakpa? Okay, so lakpa, for those who are not Yoruba speaking, is fungal infection or ringworm. So ringworm, it has to be properly treated. Most people don't treat ringworm properly. They go and be using blade and putting some stuff. That is not how to treat it. Sometimes for ringworm, you have to use oral drugs that the child will have to take by mouth, oral antifungal. And sometimes we can treat them for 6 weeks. 6 weeks is that long. So but most people, but there are some drugs that we can give for 2 weeks, but the minimum dose you can even give is 2 weeks. So most parents just do all those things and they expect it to disappear. No, so you really need to go see a pediatrician. I don't think the health center they are equipped to treat fungal infection. You need to see a doctor, preferably a pediatrician, and let them treat the child properly. And then hygiene is very important to prevent recurrence. Make sure everybody else in the family is treated, and washing, all those things. There are so many things you need to do. Okay. Another person say my baby of 17-month-old right leg is bald. Why the left leg is normal? What can be done? It depends on how seriously bald the leg is. Is it really significant or not? Usually both legs tend to affect both legs. The kind of causes of both legs tends to be both legs. So I'm really curious about this only one leg being bald. So we need to see the child first. We need to see the legs. We need to be able to make a judgment. So I would say, if you want to post on our Facebook group, since you're somebody on the group, you can post a picture of that leg, let's say, because there's some level of bowing at this age when they are toddlers, when they're just walking, and as they walk, it will just straighten out. But there's a level that is so significant. We are looking at things like rickets, or some other condition in the legs called Blount disease and all those kind of stuff. So if you post a picture, we'll be able to guide you on what's next to do. But most time there's really nothing wrong. All right. Sherry, she's saying, can I give soya bean powder, mashed bean during the first week it started solid? Okay, so if you are just starting complementary feeding, Cherish, I'm really suggesting you go to our Facebook group and go and do our guide section on complementary feeding. It's very important because there are principles behind what you do, how you do it, how you give it. It's not, there's something wrong with the soya bean itself or the mashed bean and all that, but there's a way to introduce things. So for example, when you're just starting a baby, it's better you start with purees or porridge before you go to something more solid. And then you have to do one food at a time before you start doing mixed feeding. So there are lots of principles behind this thing. So you really need to go and do that guide section. There are a lot of short videos, and there's an article that you can read because it guides you what can you give, how often do you give it, what quantity do you give it, how do you do it. It's I think it's a very comprehensive training for those who are starting up. And please just keep breastfeeding. You'll be just 6 months, so you can keep breastfeeding. Breastfeeding is still 80% of the child's food, and at this point you're only going to introduce 1 or 2 new meals. So you need to understand, so that you don't I just find that mothers get frustrated because they don't even know what is the right expectation. What quantity should the child be taking? And when the child doesn't take it, then they start getting frustrated. Then that means that the child is not taking that food. Whereas the child does not mean the child is not taking the food, but because the parent think the child should finish 100 meals, when the child just need to take only 3 spoons for the first day, then it becomes a trouble. So I always recommend that parents do that guide course first before they do anything else. So I hope that will be more helpful. 7-month-old baby poo immediately after each feeding. What should I worry? You don't need to be worried. Babies can poo after every feed, and it is not something wrong. It is what we call gastrocolic reflex. So in other words, when food enters into the baby's stomach, it relaxes the intestine. What the baby is passing out at that point is not the food you just give the child. It is the food the child has already eaten, that has been digested, that has been absorption has taken place, and the stool has already packed into. So it is just that there's a relaxation of the gastrointestinal tracts, and then the baby will feel like making a poo. Even some adults feel it. Just as adults, you can inhibit it. You can decide, I will not go to toilet now. But there's nothing wrong. It's just a reflex that we all have in our body. So there's nothing to worry about. All right. Oh my goodness, there's so much question. I'm trying to rush through. Okay, Edith is asking, how do you treat stuffy nose in a 7-week-old baby? Number one, why is the baby 7-week-old baby having stuffy nose? Exclusive breastfeeding, keep the baby warm. Don't expose the baby to people with cold. Most of those stuffy nose are viral infections. They will resolve on their own. If the baby has mucus plug blocking the nose, you can use saline drops. It will to soften the mucus. Please, you don't always have to give saline drops if there's nothing blocking the baby's nose, because I see a lot of mothers thinking the saline drop is a magical drug doing something. It's not doing anything. It is only making sure that whatever, some babies have this thick kata or mucus plug, like I call it, and it's blocking the nose, so they struggle to breathe, because babies always breathe through their nose. They must breathe through their nose. So anything blocking their nose, and it's a very tiny hole, they will struggle to breathe. So we put the saline drops, it will soften the mucus will flow out. If the mucus is already flowing out, you don't need to put saline drops. So you need to understand the principle behind what you're doing. So that's what you should do. But if your baby is having fever, your baby is coughing and is struggling to breathe, not through the nose, like baby is having respiratory distress, then you really need to take the child to the hospital for a pediatrician to see. A pediatrician. Well done. Lord will crown your efforts. Thank you. Thank you. Thank you, Facebook user. I can't see your name. Thank you. Lovina is saying, my baby of 3-year-old has fever. I gave it para, it stopped, never come again. Is it necessary to go back to the hospital? No, you don't have to go to the hospital if the fever has stopped. There are many reasons why baby can have fever. Even the fact that your room is too hot can make a child to have fever. And if you correct that, then that is fine. So you don't need to take the baby to the hospital if the baby is not having fever again. That's a good thing to do. What age should an adolescent stop seeing a pediatrician and start going to the GP? Good question. That varies from one country to another country. And I know there are some people that don't like leaving their pediatrician, even when they are 21 years old or 25 years old, they still want to see their pediatrician. But in some countries, pediatricians stop seeing people as early as 16 years. Some Technically speaking, 18 years is the cutoff for a pediatrician to see. But in some countries, pediatrician will still see, like for example, children with special needs, even though they are 18, 25, they are actually, age-wise, they are still lower than that. So we may still see them. And in some country, pediatricians see them as long as they want, as long as you are comfortable coming to see the pediatrician. And whereas some children, by the time they're about 14, 15, they are also not comfortable seeing a pediatrician. They want to see, they feel like they are too big, they are not adults. So it varies, but technically speaking, a pediatrician should see your child from 0 to 18 years. The definition of a child in UN, UNICEF, according to the United Nations, is any person who is 18 years and below. And that is the definition of who a pediatrician should say. But it can be earlier in some country, as early as 16 years, even from 13 years, depending on the administrative capacity. Because the challenge with that is that sometimes when you admit in some hospital, because when you admit a older child, the bed capacity in the children's ward cannot take them, so they have to go to the adults ward. But otherwise, technically speaking, 18 years is our cutoff. Thank you. Baby of 7 years, she doesn't bed wet, but her pants is always wet in the morning. Is a baby of 7 years, is he a girl? If a girl, is her pants is always wet in the morning. So what is wetting the pants? That's the question. What is wetting the pants? If it's a girl, is the only thing that can wet her pants is urine, unless she's having discharge. If she's having like vaginal discharge, then you will see the discharge. You will see it in the pants, so you will know this is discharge. So if a pants is wet, she may be leaking urine. You don't have to. When you say bed wetting, it doesn't mean that you have to have a big wetting of the whole bed. That is a possibility. But some children also have what we call, they leak urine a little bit. So maybe she leak it and then she quickly stop when she realizes she's doing that, which is a good thing. Just tell her, wake up, go and use the bathroom. That's all. But you need to really investigate what is wetting pants. So that's the most important thing. My baby of 4-year-old has old age skin, scaled skin. That sounds more like a child who has atopic eczema. So you should see a dermatologist for further evaluation. But meanwhile, use a lot of moisturizer, hypoallergenic moisturizer. It will be helpful. Can you give a 6-month-old baby boiled egg to eat? Technically, you can, but a baby, when you are a 6-month-old who is about to start eating, it should not be started on solid like a boiled egg. You should start with soft porridge, something more liquid, closer to the milk. So you don't go from complete liquid to complete solid in one day. That is what we're saying. So this baby can take boiled egg, break the egg into the pap and make it into a porridge. So that's how to do it. So then as they get older, by 8 months, then you start giving them more solid mashed. By the time they're about 1 year, then they can be on full solid. So you really need to understand. So Daniel, Florence, you need to go and do our guide course on complementary feeding as well, so you have that better understanding. What quantity of food should a baby of 1 year take per day? So there's a concept we call 5 a day. So you can give as much, but it's not just fruits and vegetables. You should have 5 portions a day. So that's just some recommendation. But the most important thing is that you can use the fruits as your snacks in between your meals or as part of the meals, depending on, it doesn't have to be only the fruit, but it can be vegetables. So whatever vegetable you also have to the other food that the baby is taking is also fine. So that's what I would say to that. All right, thank you. Final question. The guide on the Facebook is not showing up for me to use. So if you are using Facebook, you need to use the full Facebook app to see the guide session. You need to go and check Facebook on the browser, because if you are using Facebook Lite, which is what most of you use, you're not going to see the guides. But if you are using Facebook, the full app, you will see it. It's in our Facebook group. If you just ask us in our group, we'll show you a picture of, and we'll circle the guys, so it is there. But it's not. I think those who are using Facebook Lights may not have it. So if you need to download the full Facebook app or use Facebook on a browser on your laptop, for example, and then you should be able to see the guide section. All right. I think our time is up. I hope there's no other question we've left out on Instagram. Thank
Instagram now. Can we just quickly take them? We have about 3 of them on Instagram.
Okay, 3 is not so. Let's take 3. If it's 3, we can take it, but don't add more. All right, let's go.
When palm oil is added to the pap, can I still add sugar?
Yes, you can. They're not the same thing. They're doing different things. Yeah.
Okay. Another said, what are the fruits I need to start? What are the fruit that I need to boil before feeding my baby, and why, please?
You don't really need to boil any fruits. People, I don't know why people do that a lot. It's just a cooking style, So, for example, if you want to give a 6-month-old like a fruit as a base, maybe you want to use the carrots or the pea or all those kind of things. Of course, it's going to be hard. So those ones you need to boil, and then you need to mash, or the best option is to blend them, and then you blend it. But really, there's no technicality about boiling fruits or anything like that. So, but you can blend them. You can make them into smoothies. You can different. It's about food preparation style. So some people, when you are making cereal, you want to use fruit to add to the cereal, or you want to make like a carrot kind of purees and all those kind of people. Some people do apple things and all that, but there is no fast and hard rule about boiling fruits and all that. It depends on what you are cooking. It depends on what form of how do you call it now? What form of recipe of the food that you are making for your child. But you don't necessarily have to boil any fruits. But if you are using hard fruits, the baby cannot swallow them, then you have to puree them. You cannot add milk to them. So different. I personally don't like giving parents like this is a recipe. That's not my job. My job is to teach you principles and to say when you are making food, there must be this carbohydrate, there must be protein, there must be dairy, there must be vegetables and all that. So how you combine it together, it varies from culture to culture. We all have our way of making our food. So use your own cultural way of making your food. So a Yoruba woman now will make a mala and do ewedu, and ewedu has to be boiled. It's still vegetable. Whereas in some culture, they heat the vegetable like that, raw. They don't boil it. They don't cook it. So it does not mean those who are cooking their own vegetables are wrong, or those who are not. But if you are cooking vegetables, make sure you don't cook it for too long, because so that you don't lose all the vitamins you are trying to, because it will destroy anti-natal vitamins. So the closer to the raw form of your veggies and fruits, the better the preservation of the minerals and the vitamins that are in them. So it's a cultural way. Different people have their cultural recipes. Just do what works for you. Yeah. Is that all?
That's all, ma.
Thank you. Thank you so much, everyone. Thank you so much for joining me, Temitope. Initially, it was a little bit rowdy, but I think we got our groove at the end. Thank you so much for joining us. So, this program has been brought to you by Atp Live Foundation. We are really committed to the health of your children. If you still have questions, no problem. Just go. Yeah.
We're ready to take your question from Monday to Saturdays, please. You can drop your questions. Good.
Yes, so just drop your questions Monday to Saturday. If you have questions that are sensitive, you can post them anonymously. For Instagram people, we don't do DM. We don't do DM because our Instagram is being handled by different people at different times. So the person who is on the group on the Instagram may not be a pediatrician, so the person cannot answer your question. So the best place to ask your question, the mechanism, the way we do our work, it works better on our Facebook group. So it's better to do our Facebook group. You don't have to put your name. You can ask your questions anonymously. Nobody will know your name, because a lot of people send me inbox like, I don't want my husband to know, I don't want my friend to know. Yes, we have the anonymous option, so you can post anonymously and nobody will know you are the anonymous that is asking that question, as long as you don't give yourself away, because sometimes some people ask question anonymously and then you start to answer the question, then they came out anonymously to respond to you. I'm like, okay, now you have let everybody know you're the one. So please feel free to ask a question. And also you can go to our website, lots of articles on child health issues. If you have any topic you want us to talk about, you can send it to us and say, talk about this. I doubt there's any topic we've not talked about, but we are happy to hear and talk more about them. And if you want to support us, we do outreaches beyond our Facebook group stuff. You can check us out on our any of our platforms, and you will see how you can support our outreaches as well. So thank you so much, everyone. Thank you so much for joining us. We'll see you.
ATPL, please. We have our Ask the Paediatrician family where you can ask your family questions. Take questions today too on ATPF.
Yeah, so we have the adults group. That's the Ask the Physicians family. So you can, if you have questions that are not children related, you can ask on the ATP family. All right, thank you so much. I think we've got to go now. We'll see you again next week. 6 p.m. same time next week. Bye.